Support Vitiligo presents Ask an Expert FAQ Frequently Asked Questions video series. The Unani Perspective with Padma Shri Dr. Waheed. FAQ 1 Vitiligo or leucoderma and diet. Disclaimer: we believe in working with vitiligo experts from different fields and are genuinely catering towards the vitiligo community. This video series intends to answer various frequently asked questions asked by many of you and to educate the general public about various aspects related to vitiligo. This is not an alternative for in-person consultation. So, doctor, vitiligo and
Yes,
leucoderma are same, or are they different from each other? Or
def-
leucoderma leads to
def-
vitiligo?
yes. Some there are some diseases which can lead to the vitiligo for
Hmm.
sure, but
Hmm.
not all the leukoderma cases are not vitiligo. But in a society, vitiligo is generally called as a leukoderma in
Yeah,
society. But scientifically, if you go through with that, not all leukoderma cases are not vitiligo, and all vitiligo cases are not
leucoderma. Okay,
leukoderma
okay,
for
doctor.
sure.
Okay, thank you. So now moving on to the diet part, doctor. So there has been many questions related to diet and vitiligo or leucoderma. So people have always been asking. So now to start with, what is the role of diet in managing or treating vitiligo?
See, this is a common the thing you must have known that the diet allergies and that diet incompatibility are the two words which are very important in today's life. Some people are allergic to certain articles, and
Hmm.
some food in other combination with other food may lead to some compatibility. So there's a great role of diet into the vitiligo. You know, vitiligo is an autoimmune disease.
Hmm.
Basically, except segmental vitiligo, all types of vitiligo are because of the autoimmunity. And there are certain diet factors which has the influence on the autoimmune mechanism,
Hmm.
which can aggravate. Like, but for sure, it's all depend upon the individual biological system. Some people tolerate, some people have allergy to certain things,
Hmm.
some people may not have allergy to something.
Hmm.
Some people have a great incompatibility with combination of the some diet articles. By and large, entire seafood is considered to be an aggravating factor in vitiligo. Poultry, chicken, like eggs also, poultry, eggs also. Eggs, chicken, and fish, it mostly contributes to the aggravation of vitiligo. So we always advise our patient not to take it. The reason behind that is fish is considered to be a very good protein. Diet-wise is a very good.
Yeah.
But you know, pigmentary metabolic system, vitiligo is a pigmentary metabolic defect.
Hmm.
And all these pigmentary metabolic diseases are very sensitive to this diet article. Certain things which can prone to cause the aggravation of these metabolic disorders. The top among these diet articles, the fish, chicken, and egg. In addition to that, we ask our patient not to take much of the citrus things like lime, lemon, pineapple, pomegranate.
Hmm.
The reason for that, we wanted to reduce the quantity of vitamin C.
Hmm.
I consciously use the word of reducing the vitamin C, not to stop the vitamin C.
Hmm.
See, the daily requirement of the vitamin C takes place through the food which we eat. There are a lot of food articles, vegetables, and fruits which contains vitamin C. So daily requirement of the vitamin C takes place.
Okay.
You know, vitamin C is an oxidizing agent
Hmm.
which brings your which makes your color pigment lighter. So it interferes with the dopa reaction, which forms the pigment melanogenesis. The process of melanogenesis, that is the pigment formation.
Hmm.
It blocks that. Because of that, we advise not to take much. But however, partly to come to to support the daily intake of the vitamin C is always advised to take. And additionally, milk products also we say not to stop, but partly restricted. You know, milk has a good source
Yeah.
of protein and calcium.
Yes. Yes.
Any number of tea and coffee along with the milk, little fresh curd, sometimes paneer, sometimes buttermilk, we always take to take them.
In
But
moderation,
not citrus.
doctor? Like in
Yes,
moderation. Yeah.
moderation they can always take. But
Okay.
the milk partly restricted, and seafood and chicken and eggs are fully restricted, and citrus foods are again partly restricted.
Partly, okay. So, doctor, this combination of food, which they say milk and fish, there is a lot of like controversy or myth surrounding it. So, it is again case dependent, right? It's not like every person with vitiligo having milk and fish will have more patches. It's not exactly that, I guess.
I'll give you an example. So suppose there's a family of 10 members in the home,
Hmm.
and there's a fish cook. All 10 members have taken that fish, consumed fish along with the milk or along with the curd.
Hmm.
But none of them has got vitiligo except one. So
Hmm.
that is why whosoever has the susceptibility to develop the vitiligo, they only will get it, not all.
Hmm.
So this combination never works, never causes any other problem
Hmm.
unless somebody has a susceptibility to develop a particular disease like vitiligo.
Hmm.
So that is most important. If anybody has a susceptibility to develop, it all can aggravate the problem. It never causes the problem, but it can aggravate the problem.
And aggravation also is case basis, no, doctor. Not all people with vitiligo who have fish or milk may have increased patches, right? It again depends on the person's body, how it responds.
Yes, it all depends on the person's biological system.
Hmm.
Definitely, some people may not, some people may get aggravation of disease.
Okay.
But from person, it varies from not only from person to person, but it varies from type of vitiligo also. The non-dermatomal vitiligo, like vitiligo, superficial vitiligo vulgaris, non-dermatomal vitiligo, these vitiligo get mostly aggravated because of the actual autoimmunity. Like for example, if you take a mucosal vitiligo, some takes the segmental vitiligo, which affect only the half of the body or half of the lateral fault, it never gets aggravated with that because it doesn't have any autoimmune mechanism behind it.
Okay. Doctor, so the diet which like people can actually have, so what are the things which are good to have? Like even if I'm not following any treatment, if I follow a diet, so it still has an impact on healing vitiligo?
Definitely, it has vitiligo feeling. They can take good balanced diet. Like if they are non-vegetarians, they can always have a lamb or a mutton, what you call, you can always take. And country chicken they can always have. And among vegetarians, all the vegetables they can have except citrus, sour and citrus vegetables. And by and large, to support the intake of the protein, to ensure the protein intake, pure ghee they can take, little milk they can take, little curd they can take, lot of sprouts they can take. So balanced diet, all
And ice
vegetables.
cream and chocolates also, doctor.
Yeah,
Some of
yeah,
us really fond of it.
yeah. It's partly restricted. So
Yeah.
they always advise patients not to stop the chocolate, but sometimes they can always have. Not every day, but once or twice in a month,
Moderation,
or
yeah.
modulation 4-5 times in a month.
Yeah.
Like for example, younger children, they always go to enjoy in a party, birthday party with their friends. They are always allowed to take. So that's not a problem at all.
So we should always observe our body mechanism, how it suits us. To be frank, yeah. Hello?
Sorry?
No. The
Yes.
thing is, if we observe our own body mechanism, how it responds to every different food
Exactly.
item, then it is helpful. Isn't it, doctor?
Exactly. Yes, we need to observe our own body mechanism, how
Hmm.
it responds. And second thing, the most important thing is the stress, which can aggravate. It never stress. Again, there is a myth about that. Stress causes vitiligo. It never causes the vitiligo, but it take it forward. Rather, it aggravates the problem.
Spreads it.
So good diet, stay living, stay happy, deal with the people, try to share with your thoughts. Any problem with regard to the vitiligo or disease, you're free to talk to the doctor, get your questions or doubts answered. And probably that will lead to a great happy life and well controlled and repigmented vitiligo.
Hmm. Thank you, doctor. And doctor, one more thing is, in some cases they say brinjal to avoid the vegetable brinjal. So is it true that it has a trigger on vitiligo?
Generally, it doesn't have a trigger on the vitiligo unless otherwise some people are very allergic to it. Again, the concept of the allergy and incompatibility comes over here. Some people take brinjal lot and never gets a vitiligo, get aggravated. And some people may not tolerate. Even some normal people also. That all depend upon the susceptibility. For example, some people are allergic to some diet food articles. So based on their observations, they have to avoid. Otherwise, no.
Okay.
Normally, people can, those who can tolerate it.
So it's not related to vitiligo. Brinjal is generally not related to vitiligo as such. It is in general.
Yes, in general.
Okay. A big thanks to all our volunteers. Vitiligo expert Dr. M.A. Waheed. Video editing by Lalita. Content by SushAmita and Swati. Design by Satish. Overall ideation by SushAmita. This initiative is supported by Youth for Seva. Thank you. To know more about Support Vitiligo, visit us at www.supportvitiligo.org.